The East Daily Download is sponsored this week by the following.
Hello, my name is Dr. Anna Imhoff. I'm a board-certified obstetrician-gynecologist at Greene County Healthcare. I work at KP Reynolds Medical Center in Snow Hill, North Carolina, and James Bernstein Center in Greenville, North Carolina. Today, I want to talk to you about the importance of cervical cancer screening. Basically, cervical cancer is a kind of skin cancer that occurs at the opening of your womb. It's caused by a virus called the human papillomavirus. This virus is extremely prevalent. About 80% of all people will actually come in contact with this virus at some point in their lives. It's something that's just extremely common. Most people clear this virus, but some people will actually kind of hang on to it, and that virus gets into the cell and gives the skin cell some instructions to grow in an abnormal way. So we're looking, when we do a pap smear, to screen for cervical cancer to see if this virus is having any abnormal activity. So modern pap smears actually look at two things. They're looking to see if there's any abnormal cells there that might be precancerous, and they're looking to see if there's any HPV activity. The combination of these two things makes pap smears much more accurate than in the past. Probably most people were taught that they need a pap every year, but in reality, you need one about every 3 to 5 years if your past ones have been normal. During a pap test, we just take a quick look, collect some cells, send them off to the lab, and get a result in a few weeks. The goal is to find precancer cells. Finding actual cancer on a pap smear is actually extremely unusual, and that's because, good for us, HPV changes the cells very slowly. So there's a very long precancer phase, so there's a big opportunity to go ahead and catch that early disease before you actually have cancer. So with this modern pap technology, we've actually reduced the incidence or the number of cervical cancers in the United States quite dramatically over the last 40 years. The age to start pap smears is age 21. If you have teenagers, I cannot stress enough the importance of HPV vaccinations. The HPV virus has many subtypes, and the vaccination covers the most dangerous ones. The testing that we do here is included in sliding fees, so if you don't have insurance, not to worry about the cost, it just is included in the visit. Thank you so much for your time, and we look forward to seeing you here at Greene County Healthcare.
The East Daily Download is sponsored this week by the following.